Hi folks, and welcome to today's video, why your low back pain has still not gone away after physical therapy. Now folks, I do produce a lot of good content for those folks out there suffering with low back pain issues, sciatica nerve pain issues, bulging discs, herniated discs. If that's you, then hit that subscribe button. You're notified when I upload some great content for you folks to get you back on the road to recovery. However, without further ado, let's get into today's video. All right, folks, so today I want to talk about why some people, even after they've been through physiotherapy, they've still got low back pain issues, sciatica nerve pain issues, bulging discs, herniated discs, etc. So this video may be a little bit controversial. Okay, I apologize up front if I upset anybody in the medical field, but these are some of the things that I've seen working with many clients over many years. Some of the feedback I've got, people who've been to physiotherapy, they've come to me because they've not gotten any better. So I'm just going to go over 4 of the top things that I've found coming back to me from feedback. All right. So number 1, okay. The problem is the plan you've been given is too generic. All right. So you may be going to physiotherapy for 14, 15, 16, I don't know, 20 sessions. Yeah. Month, 2 months, 3 months of physiotherapy. And you go up there on day 1 and you're basically, there's you, 2 other people, and 1 physiotherapist. One person's got back pain, one person that's got a knee issue, somebody has got a shoulder issue. And each person is given the generic program for that issue. Now, this is not a fault of the physios generally. Sadly, I see this a lot today, both in Europe and North America. Time is money, okay? A lot of clinics, we want to get as many people through the door as possible. And to see as many, get them sessions in as much. So I want to make as much money as possible. And of course, who suffers is the patient. They don't get that one-to-one care that they deserve because, there are certain generic exercises that have been shown throughout the research to work really well with people with low back issues. But, you can't forget everybody is an individual to some degree. You have to ask about their previous history, previous sports, previous accidents. There may be some underlying conditions which are contributing to their issue. You can't just treat the symptom, okay? Because if you don't treat the cause, the symptom may come back again. So you want to make sure that the physiotherapist that you're working with, they do ask lots of questions. They try to tailor it for you, adapt exercises. You want to tweak it. I mean, I've got my own sort of core methodology that I use, sort of core exercises, but I always tweak them depending on the individual's, range of motion, age, previous injuries, etc. But all too often, I do see these generic programs being given out to people and they just don't deliver the results, unfortunately. So number 1 is too generic. Number 2 kind of follows on from that a little bit, and that basically is the exercises they give you are too difficult. What do I mean by that? So, too difficult. So again, you've gone into physiotherapy, you've been given this potentially generic program, or they've given you some of the classic exercises like front plank or the bird dog, which is very famous now for low back pain issues. But maybe you don't have the core strength or the stability to actually do those exercises. And again, I've seen this many times. Or they're giving you exercises which have worked with previous patients, but they cause you pain. And the idea of physiotherapy is to make you move, to get you moving, but to reduce your pain, to be able to, handle more stress, like more activity. Maybe you've still got some pain, but you're doing more. You're able to have a better quality of life. You shouldn't be doing more and having more pain, right? That's not how physiotherapy is supposed to work. So some exercises that people are given, they're just too tough for them to start. As an example, I have a video and it's on doing standing core exercises designed to stabilize and strengthen your core, but you can do them purely standing. And it's I designed for people who basically, they have trouble getting on and off the floor. They've got bad knees, bad hips, okay, bad ankles, or maybe not too sure on their feet. So that video is actually going to pop up at the end of this one if you want to check it out. So please stay at the end of this one and you can go and have a look at it later. All right. So yeah, just be conscious of if the exercises are too difficult, say something to your physical therapist. If they're not willing to adapt them, then perhaps it's time you changed your physio. Okay. All right. So let's move on to number 3. Now, all good physios will give you homework to do. Now, homework will involve maybe exercises, stretches that you're to do at home. And I basically call number 3 the homework fail, okay? Because you can be going to the best physio in the world. You can be going there 3-4 hours a week, but if they've given you stuff to do at home and you're not following through at home, okay, with your stretches, with your core work, they should have taught you how to move correctly, good spine hygiene, certain things to avoid, certain things to do, you know, maybe even nutrition advice as well on anti-inflammatory diets, etc., that kind of stuff. If you're not following through on that, you're going to struggle to get better, okay? Doesn't matter if your physio is the best guy in the world, doesn't matter if it's the best program in the world. If you're going home and you're not sitting in the right position, if you're, you know, doing yard work, if you're doing excessive exercise, you're jumping back into deadlifts, running back into your sport and just hurting yourself again, you're not going to get better, okay? You basically have to own the work that you do. Now, for example, what I do with my clients is, obviously working remotely with some people, is I get them to check in with me. So I give them various questionnaires to fill out. They've got daily journals to do, daily questionnaires, kind of a reflection journal to do as well. I get them to send videos to me. I want them to be accountable, okay, for the work that I'm giving them to do. So they send the videos to make sure they're doing it correctly. We can then track their progress. I can give them feedback where necessary to make sure they're always improving and attaining those goals, which for most of you guys, I'm sure, is reduced pain, all right? So yeah, number 3 is going to be that homework fail. Now number 4 today, the last one, is actually a pretty big one. I've seen this a lot with many, many clients that have come to me in the past. And that is, you've done your 14, 16, whatever, 18 sessions of physiotherapy, and then you stop. You give up, you stop all exercise, okay? And what do you do instead? Well, perhaps prior to the injury, you were an athlete, maybe an amateur, higher level amateur athlete, or you were a gym user. You stop your physio and you go right back to your previous activity. What do you think is going to happen? Well, if you've not built that base, that strength for you to be able to do your activity again, you're going to regress, you're going to hurt yourself, you're going to go back into that pain cycle again. Because what a lot of people don't understand is, very often when physio finishes, it gives you the basic tools to be reasonably pain-free during your daily life, okay? But if you're an active individual, you need to bridge that gap, okay? You can't just jump back into deadlifts, to, you know, playing high-impact football, rugby, ice hockey, whatever it could be, golf, you know, high-velocity rotational sport. You've got to have a program which will take you from basic physiotherapy to be able to play in your sport. And it's got to be specific. So what I mean by that is you want to be doing some strength training work, some strength and conditioning work with exercises which are specific to your sport so you can train the body, make the tissues ready for that activity you're about to undertake, okay? So I see a lot of people fail who were athletes, who were high-level competitors, finish physio, straight back to the sport, and they're right back in the pain cycle again. Similarly, you may have been, prior to the injury, a sedentary person. You had a desk job, didn't do much activity. You hurt yourself, something happened, you go to physiotherapy, do your sessions, and you stop, right, after the sessions are over. What happens? Well, you go back to your sedentary lifestyle, you do nothing, you're sitting around, okay, in the house at night, eating chips, whatever, okay, getting lazy, muscles getting tight, muscles getting weak, and you go back into that pain cycle again. Look, I'm not saying you have to undertake, you know, a huge exercise program, all right, but the fact of the matter is, low back pain likes exercise, okay? So it is beneficial for you to be active. Get out walking, hill walking, swimming, ride the bike, do something. Take up a sport, take up an activity, because your low back pain will like you for it, okay? Please just don't go back and be sedentary after you finish physio. So guys, that is essentially some of the 4 things I've come across working with clients why their physiotherapy has failed. Just to recap, 1, it's been too generic, the program's given to them. 2, it's been too difficult, some of the exercises they were given. Number 3, they failed at doing their homework. There was no accountability to their physiotherapist. And number 4, they stopped doing the work. All right, guys, listen, I hope this video was not too controversial. If you have been a patient of physiotherapy or you are a physiotherapist yourself and you want to share your experiences, complaints, whatever, please do down in the comment section down below. If you have been struggling with your own back pain issues, sciatica nerve pain, herniated disc, etc., I am here to help those people out there suffering with those conditions. If you want, hit me up in the comment section. You want to ask me a personal question, you can also send an email to me. It's down in the description as well. I am here to help you guys, all right? So listen, folks, don't forget to like and subscribe, okay? Share this video, and I'll see you next time. Have a great day.